Jenkins in the newsroom for us. And today, kids 12 and older can now get their first dose of the Pfizer COVID-19 vaccine.
The CDC approved it yesterday afternoon, and the state then gave the green light last night.
Well, this morning, we're joined by Dr. Jim Conway. He is a UW Health pediatric infectious disease specialist and the medical director of UW Health's immunization program. Dr. Conway, thanks so much for being with us this morning. I'll jump right in here with a question that I asked our pediatrician. I've got 3 kids. If young people, generally speaking, don't get that sick when they catch COVID, why is it worth the risk of having them get this relatively new vaccine?
Well, first of all, it's not that new a vaccine. We've been doing this now for over 6 months, and this particular vaccine, over 100 million doses have been administered here in the U.S. alone. So there's plenty of safety data that shows that this is absolutely safe. But what we really believe is that kids deserve to be protected from this disease. And while most do fine with it, many do not. And we've had over 13,000 hospitalizations. Over 300 kids have died from this disease this year. And more importantly, they also are shedders and can drive transmission in many communities and within their families.
And so, Dr. Conway, you do talk about the experience that we have with the vaccine so far. But as a parent who is watching this morning with a 13-year-old, why would they need to get their child vaccinated? What would you tell them about their concerns? Because it seems as if some parents are excited about the opportunity to vaccinate their kids, but there are also many parents who are sitting back and saying, oh, I just don't know about this yet.
Well, first of all, it's an unpredictable disease. I mean, that's the problem with most of these diseases as they spread, is that each person has their own version. And while many kids do fine with it, many do not. And really, every kid deserves to be protected. The other, though, is that this really is what's going to allow people to feel much more normal and to return to much more normalcy. You know, the whole masking debate is really sort of upside down, because the mask is primarily to protect people that are around somebody who's sick. The mask only partially protects the person wearing it. But the ability to vaccinate people is what really gets us back to normal and allows people to start socializing more normally, get kids back into actually more normal activities safely, so that everybody can feel like they're doing things in a comfortable way. You know, I think that kids have really suffered this past year and a half, missing out on so many other activities, and getting back to extracurriculars and intramurals. All these things are really important, and the way to do that and the safe way to do that is to get people vaccinated.
We're talking with Dr. Jim Conway of UW Health. Doctor, can you explain the process here a little bit? We know the Pfizer vaccine is approved for this age group now. Why not the Johnson & Johnson or the Moderna at this point? And do you anticipate those relatively soon being cleared for younger people?
Well, nothing gets approved until it's been studied in the population that it's going to be used in. And so the Moderna vaccine and the Johnson & Johnson vaccine are currently in trials, and they gradually are going into younger and younger age groups. So they are working towards their 12 to 17-year approvals over the next couple of months, and we expect by the end of the year probably both of those vaccines. But again, safety is just as important as efficacy, and so it needs to be proven that these work well, but also that they're safe in each of these age groups. You don't just jump in and presume based on the fact that it works well and is safe in older groups. And so I think that's the guarantee we have to give to parents and to communities, is that these are being tested in a very methodical manner, and only once that testing is complete will FDA review it, and then even after that, CDC and the ACIP need to review and make sure that they approve that this is really reasonable and worthwhile.
Dr. Jim Conway, you have an accomplished title, so I want to make sure I get it right. Dr. Jim Conway, UW Health pediatric infectious disease specialist and the medical director of UW Health immunization program. Thanks so much for your time and expertise this morning.